Hello, hey everyone, welcome to Sleepy Radiology classes. And I promise it will be easy for you. Hello everyone, welcome back to our Sleepy Radiology classes. And today we are here with a small topic, that is angiography. And this topic was requested by my students where I am working right now. So this topic is for you and I hope this will be very much helpful for you. So when we talk about angiography, what is angiography? Angiography is the technique which we perform mainly on the blood vessel studies. So we can say that angio means blood vessel and graphy means the study. Okay, and this technique can be direct technique or indirect technique. We can directly inject into the blood vessel or we can indirectly also inject into the blood vessel. And in this study, mainly we will see the artery and the veins of our body. So we have various types of angiography named on the various area we do. And suppose if you are doing for heart, we say it as coronary angiography. And there you are going to just only see the heart and the coronary arteries. Next, something we have called as cerebral angiography. And this cerebral angiography is mainly cerebral. So cerebral means what? For head. So that is mainly for the cerebral arteries present on the head. Next we have peripheral angiography. So we all know the peripheral parts of the bodies are the hand and the leg area. So they are the peripheral angiography. And when we talk about the renal angiography, that means kidney means renal, so that is renal angiography. And so and more we have, like we have head and neck angiography, we have abdominal angiography, we have thoracic angiography, and we also do angiography for the iliac crest where we see the femoral veins and arteries too. So again we will say you what is actually the angiography. Just it is the study of the intervascular structure and how we do, as our blood vessels are the structures which are in the category of our soft tissue, and basically soft tissue doesn't highlight in the x-ray very clearly when you are seeing with x-ray. So that is why we are going to inject a foreign body. What is actually the foreign body? That is nothing but our contrast media. So I'll give you a small example. You have a white cloth and you have drawn a flower, but this flower will be visible to you right now? No. Same is our soft tissue. So once you are putting the color, red color, so you can see the petals of the flower. Once you put the yellow color, you can see the middle portion of the flower, and once you put the green, you see the leaf, and that makes a perfect diagonals on the white cloth. So same is our angiography, where we are going to inject the contrast media and we are going to see only the blood vessels and we are going to highlight them. So basically contrast media has the highest attenuation number we have to select, or high atomic number, so that it would be visible to us as a bright image. So in X-ray and CT, we always describe the image based on density. Higher the density, image will be bright. Lower the density, image will be black. Similar the density means same to the water level or soft tissue, grayscale, ISO. Clear? So once you're using X-ray modality, your hyperstructure will show always bright because that is a negative image. But when you are putting on fluoroscopy live mode, your any higher density structures will show you the black color because that is what we are getting the positive image. Okay. So next is, what are the types of angiography we have? We have conventional catheter angiography. It is also called as selective angiography. We have DSA angiography, that is we can use the computer and we can subtract the blood vessels or the bones as per our criteria. If we are subtracting the blood vessel, it is called as bones study. If you are subtracting the bones, you will get the blood vessel, that is called as blood vessel DSA. Okay. Next we can use the CT modality, and nowadays we can also use the MRI to see the structures of the blood vessels. Next is what are the main indications for our angiography. So the main indication will be like aneurysm, dilation of the arteries. We have vascular occlusive disease, that is occlusion. Occlude will happen, blockage will happen. So that what will happen? The blood vessel will become narrow, stenosis will be there. AVM, arteriovenous malformation, means secondary passage of artery and vein, or false passage of artery and vein. Malformation, malformation means false. It will not be an artery or vein, but it will act like an artery and vein. ABF, arteriovenous fistula. So fistula means another passage or opening. So that is all about the indications. These are the primary vascular diseases. Next is the indications, like we can have hemorrhage, we can have strokes. In that case also we'll go for the angiography, and also for the intravenous percutaneous procedure. Percutaneous means inject into the blood vessel. Like if you have angiography, or if you have a blockage, we have to remove the blockage. Then we go with a technique of repairment that is called as angioplasty or embolization. So next also you can find out the congenital diseases, like which may be byborn, and we can have pre and pro-operative diffusions for vascular anatomies, and assessment of tumor also can be done with the help of angiography. So what are the contraindications? Contraindication means when you are not going to do, totally नहीं करना है, ठीक है? So in that case, if a patient has recent MI, myocardial infarct, if the heart rates are not working, arrhythmias are there, so you can't take this procedure. Next is if there is history of contrast reaction, allergy reaction, that means you have to ask the patient of history of seafood allergy and anaphylaxis. So you can't do this study. Next is with impaired renal status, if the GFR value is not uh, normal, it is high, you can't do the angiographic study. In case of pregnancy coagulopathies, that is anemic patients, hepatic failure, residual barium, if a person is having barium, that barium will interrupt in your image, superimposition will happen, so you can't do these studies. And also for any kind of infection or swelling in the site of puncture. Okay, is it clear to you? So next you can see this is the angiographic room setup. We have a C-arm. Next we need a display monitor where we will see the images, and their images will be recorded in the form of frame per second. We can use 4 monitors. One first monitor will be the image of the previous studies. Second monitor will show you what is happening right now just before, and the third will be showing you the just previous to you what image is done, and the fourth monitor will be showing you the ongoing process. If you are using by monitors, first image will be showing you the previous image, and the second monitor will show you the ongoing image. We require a floating table because CR moves in 360 direction, and if you don't have the floating table, this CR may get struck and it may cause unwanted hampering in the image. Next you require the protective shields. There we are going to use the lead flaps, that is and we are going to use foot paddles to give the exposure. So along with our angiographic room, along with the CRM units, we also have to see that we have the following additional facilities. Like we require an anesthesia workstation because sometimes we have to give the general anesthesia to the patient, so a team also is required in that case. Next we have to require the facility for emergency crash cart trolley, and it is also present in our CT scan department and radiology department where we are having the interventional procedures. Because if we have any kind of emergency, that time we can use the drugs present there, the life saving things present there, and this is mainly opened or used during the case of emergency only under the guidance of radiologist and emergency team. So never ever try to open and use these items when or as usual for your purpose. Next thing is without which nothing is complete is the operating console. So operating console is going to help us to set the protocols to do the scan, and everything it will be done with the help of this. Additionally, for the angiographic room setup, you have to have a main entry door. Via this door the patient will enter to your angiographic area or suite. Next you have to use a recovery room area where after your procedure you are going to shift the patient, and all these things we maintain in the cath lab only, not in CT and MRI procedures. Just if emergencies are there we can use them. Cath lab is catheterization lab, and there we are mainly using the catheters in our interventional studies. Next, you require a changing room for the patient if needed, and then where you can also record the data, pre and post data. Next is we require a catheter room where all the catheters will be stored. Just keep in mind, in the procedure room there will be limited number of catheters, not all the catheters. Next, we have a washroom where the patient will where the staffs and the residents will maintain the hygienic, and that is the sterile field area. And next, we have an equipment room where we can have all the additional equipments if needed, like we can have an access tray also. Next is, see, they moving to the procedure. What is the procedures are? We have pre-procedural care. So pre-procedural means the care which is given to the patient prior to the study, that is checking of vital signs, changing the dress, cleaning the area of puncture. That is the pre-procedural area. Patient instruction, what you are going to do, and filling up of the informed consent form. Next is you require the equipment preparation. What are the catheters you require, what about guide wires you require, what are the procedures. Next is establishment of vascular access, contrast media, you have to have filming techniques, and post procedural care. After the procedure, what are the cares you have to do for the patient, instruction, and when you are going to discharge them. So at least remember, when you are using cath lab procedures, at least 24 hours observation with repeated 3 hours vital check is mandatory for the patient. Next is, when you are doing the procedure pre, you have to evaluate what is the history of the current problem, any medical history or surgery, history of allergy and current medications, and also review of certain follow-up procedures like chest x-ray, CBC films, and ECG reports. Next is, when you are doing the patient evaluation, you have to keep in mind that this all things are mandatory in your angiography procedure: HB, total count, ESR rate, platelet count, CT, clotting time, BT, bleeding time, prothrombin time, partial prothrombin time, INR, and renal function test is very much important. That is very much important for CT procedures also, because the contrast have to wash out from the body, and if the GFR is not working properly, is not normal, above high, your contrast will retain in the body and it will cause unwanted irritation to the patient, as well as doses also will be increased in that. Next, you have to see the HbS, Ag, HIV, chest radiograph, and ECG is the baseline. So these are the normal values of our procedure. So patient should be at least 4 hours fasting, well hydrated. Why? Because when we are giving the contrast, if the patient is already in a full stomach, the contrast or glycolysis process will somewhat not happen, so we will not get a clear image. Patient also will complain of severe nausea, vomiting. So all these things will happen. So to avoid all these things, when I'll give you an example, just see one, there is a short film, Ankur murder case. So you can see what happens is, if the patient is on full stomach and if he is in the OT. Okay. Next is, patient should be well हाइड्रेटेड मीन्स एम्प्टी स्टमक, मतलब खाना नहीं खाना चाहिए बट पानी पी सकते हैं, ठीक है, वेल हाइड्रेटेड होना चाहिए, नहीं तो कमज़ोर पड़ जाएगा. नेक्स्ट इज सेविंग एंड क्लीनिंग ऑफ द पंचर साइट, एंड you have to do 1 ml sensitivity test. Why sensitivity test? If you don't do sensitivity test, you will be not aware about the patient is having allergic reaction or not. Some people may not have any kind of allergic reaction, but may have reaction to contrast media or medicines. So this test will give you a confirmation. Just take 1 ml contrast. Next, do the injection in IV and IM method, whatever your wish. IM is preferable, better. Wait for 5 seconds and see if there is any contrast reaction. Then you have to take necessary steps, like we give Avil and Dexona to the patient, and then you can continue the procedure. But it is always mandatory when you are doing any kind of angiography or contrast study. Please give 1 ml Avil and 1 ml Dexona injection, and that will save the life of the patient. Next thing is, so these are the setups for angiographic tray. I'll not go in brief. You can see here right now. Next, these are the puncture sets. Puncture set, what you require is the guide wire. You require the arterial needles, micro and catheters too. So catheters. So what is the purpose of catheter? Catheter is going to guide the contrast to the desired vessel, and that is measured in French. We mainly use the catheters of the size of 4 to 7 French. So this is all the catheters. This is the pigtail catheter. This is mainly used for coronary angio, or where you have a bulk of arteries and you want to inject them in fraction of second, and you cannot introduce your catheter. So that a best example is our coronary artery. We have headhunters, side wellness. Always keep in mind, based on the size of the artery, you are going to select the catheter. You cannot simply use any type of catheter that may rupture the blood vessels. So next is the guide wire. So guide wire means guide wire. So guide wire is the wire which is going to guide you catheter towards the desired vessel. So that is introduced just prior to the catheter. You have to introduce guide wire. It will take you to the desired vessel. It will help you to see any kind of occlusion is there or not. Then you can introduce the catheter, and it is measured in inch. Next is, this is the vascular sheath. So what is the purpose of vascular sheath? Is actually multiple exchange of catheters, and it is safe for the blood vessels also. So multiple exchange of catheters can be prevented with the help of our vascular sheath. So in nowadays we are not using the catheters, we are using vascular sheath first, then we are introducing the catheters, and that technique we call it as an insertion technique, not the puncture technique. Next, so these are the contrast medias. Always remember, in angiography don't use the what to say, ionic contrast. Try to use a non-ionic contrast, because blood barrier reaction chances are less in LOCM, low osmolar contrast medias. Okay. Next thing is, so these are the excess size and what rate of contrast we use when we are using the selective angiographic method. So these are the anesthesia for whom we require general anesthesia: baby, young children, nervous patient, claustrophobic patient, and basically if the patient is not cooperative, geriatric patient, interventional procedures, general anesthesia is very much important. Next is, what are the sites of punctures? So when we talk about the sites of punctures, we have four sites like femoral puncture, axillary puncture, brachial puncture, radial puncture, and carotid. But most preferably we will use the femoral puncture, as because it is larger in diameter, straight, and easily accessible. Okay, so larger in caliper, superficially located, and easily accessible, and it is present in 4 o'clock direction in the inguinal area. So this is how we will do the angiographic procedure. So for angiographic procedure we require a technique, and that is known as the Saldanger technique, and it was invented by Dr. Saldanger, Ivan Saldanger, in 1907, and that technique became famous for the angiographic purpose. So let's move on to the technique. First is, we have to select the area, and which side we are going to select. We are going to select mainly the femoral area. Next, we are going to puncture the vessel. Done. Once puncture is done, we are going to see or look for the free flow of blood flow. So you can see there is free flow of blood. Next, we are going to remove the stylet and inject the guide wire. So we have inject the guide wire. Once the guide wire is in its position, we will remove the needle. Next, via the guide wire, we will inject the catheter. Done. Now we will remove the guide wire and we will inject the contrast media. So that was all about the Saldanger technique, and we can use these are the types of vascular sheaths we have two-way clock, stop clock. So two-way means you can inject one with the help of one saline, with the help of another contrast. So that is very good. So these are the complications for our angiography: thrombus. And always remember, when you are using any kind of needle or any catheter, or recently we are using the pressure injectors for CT and MRI, please confirm the bowel air bubble check. If you don't do, there is one of the most common is the air embolus, and that causes severe damages, even cardiac arrest to the patient. So please do keep in mind, when you are using the pressure injector or any kind of syringes, please check the air bubbles. So these are some of the angiographic images. So see, if it is circular image, that means it is taken in IITB, image intensify. This is a image for cerebral angio, and you can see here there is an aneurysm. This is the image for renal angio, and see the third image shows you that this is not a DSA image, normal angiogram, but the first image shows you that this is a DSA image. So next is digital subtraction technique. Is a technique where we can digitally subtract the blood vessels, and this is a software technique. We can do two types. One is bone subtraction, where bones will get subtracted, and another one is the vessel subtraction, where vessels are getting subtracted. So this is what is the advantage: improve the clarity of image, doses of volumes of contrast are less, and reduces the patient exposure and dose to staff also. and smaller and safer. So this is the nowadays we have moved from a cath lab to directly CT and MRI, where we can just inject the contrast via pressure injector, and we don't need to introduce the catheter into the full area. So that's why these techniques are known as the non-selective techniques. Okay, so these are the non-selective techniques. Even 3D reconstructions also can be done, volumetric studies also can be done, and that is what we is in the CT angiography. Less small stenosis, everything clear image, patient comfortable. Then you need to do pre-preparation, post-preparation. Just simply check the urea creatine level, history, bus. Then just put him, um inject the contrast media, take a shot, and just arterial phase and venous phases are required, delayed phases are required, and just ask the patient to go home safely, comfortable, life saving, time saving, less radiation dose, everything. And this makes us what is our CT angiography. Okay, next we have also MR angiography. CT में radiation है, there is contrast in the CT, sorry, radiation dose in the CT. So we have another modality, MRI. Even I will say you there is one some phases like what we say is flow phenomenon phases, like we have MRA and MRV sequences in MRI, where you need to give contrast also. Just in MRI, just remember, if you want to see the severity, how much is the uptake, then only we give the contrast, mainly in the pituitary glands or in the post-operative studies of the breast, we give the contrast. Otherwise no need contrast also. In MRI, with the help of MRA, MRV flow based phenomena also you can do without contrast. So no contrast, small stenosis can be seen, as well as no radiation dose. Wow, that's why MRI is the one of the great method. And finally, we have interventional radiologist, which we do for the treatment purposes, and that is what is angioplasty. We have two types. One is therapeutic, we have balloon angioplasty, and therapeutic we do what is called as embolization. We are using some embolic agents. Okay, so see, these are the embolic agents. What we do is for the repairment of the arteries, we do it. So this is balloon angioplasty. So if there is any plaque, we insert the balloon, we inflate the area, we then insert the we insert the IVC filters, intravenous filters. That filters collect all the debris and we clear the area, and we can have a free flow blood. So you can see there is a plaque in this area, we have introduced the catheter. Remember, these procedures are always done after the angiographic procedure, once the problems are detected, and there is no option of CT or MRI. You just have to come to the cath lab only. So see, we have introduced the catheter, right? So these are the areas. Now we have inflated the balloon. Balloon is inflated now. Done. Plaques are removed, and we have placed IVC filters also to collect all the debris. We have deflated the balloon. We have take out the area. Now you can see this, there is no plaque, so blood can flow easily. Stenosis is removed. So this technique, what we called is as known as angioplasty. So I hope it is clear to you about all the basic informations regarding angiography, and this is really dedicated to my second batch students, who are my one of the dearest students. In my life, I have never got such kind of students. Really, I like to welcome them. I like to teach them very nicely, and thank you, my team. I hope you will always shine in the future in the next time. So others, if you have liked the session, please do like, subscribe and share it. And mainly my purpose is not subscription, but try to share it to all the peoples, mainly the students, so that they can have a very easy knowledge about our radiography session. Thank you so much.